Hi, Cassie.
Oh, there we go. Hi.
Hi, Julie. I saw Julie is the host.
Yes.
We'll maybe we'll wait a couple of minutes until give people a little more time to sign in.
Okay.
Great. So, Cassie, do you want to get started? So maybe I give you an introduction, and then Julie, are you online? I saw you. Yeah. So great. Good afternoon, everyone. My name is Chuan Lu. I'm from Harvard School of Public Health, and welcome to our Superfund Research Center seminar series. So today we have Cassie James. She's from University of Colorado at Denver, and she actually co-leads the community engagement core in our Superfund Research Center. So I'm very happy to have her to start off our seminar series. So just some logistics, because this is a virtual Zoom presentation. So I I discussed with Cassie, we will hold all the questions at the end, and you can type in your question in the chat box. And just to keep the flow of the seminar, we'll hold the question at the very end. So please have your question, type in the chat box at the end. Julie Goodman, who is the coordinator of our center, will read the question to Cassie, and Cassie can answer. So Cassie, you can take it off. Thank you.
Great. Thank you so much. And I just want to say welcome to everyone to our speaker series for our MEMCARE Superfund research grant. I have my slides and presentation up. If you all can't see it, I'll trust the chat box to pop in. I want to first introduce the background for this topic. It was an evolving topic that even yesterday we were updating some of our research strategies related to community engagement in this time of COVID, because every day we're getting new guidelines from our governor, we're getting new guidelines from the university. And so this is an evolving topic. This is very dynamic. And so I expect that there's probably several of you in the research community who have experience with something similar and have ideas that you can share that might also help us with our project. And so I welcome all ideas that you all might have also to contribute. So I would first like to introduce our research team with the University of Colorado. Myself, I have a background in engineering and a PhD in epidemiology, and I've been very fortunate to be working with the San Luis Valley community since 2006. My original research projects focused on the arsenic that is present in the drinking water. The arsenic is naturally occurring along with other metals. And the research there has evolved to include also the air quality, as it's very susceptible to dust, and then translating these research findings related to environmental health into interventions to work with communities, schools, and workplaces to reduce, mitigate exposure, and then also improve health. And I'm very fortunate to have as my research assistant, Francesca Macaluso, who has been working with me for a year and is a DRPH student in our Department of Environmental and Occupational Health with a strong interest in policy and environmental justice. And she ascertained her MPH from Emory. So for this project, I'm going to give a brief introduction about the San Luis Valley community and also our two study sites that are specific to the MEMCARE Superfund research study. I'll also just reiterate what our community engagement aims are specific for MEMCARE, and then move into the discussion format related to obstacles that we encountered due to the coronavirus in the middle of our active community engagement, and then what modifications we had to do in order to continue to support the study, but then also modifications that we did to also support the community. So the San Luis Valley is located in south central Colorado. It has a population of about 46,000 people within about 25,000 households. There's approximately 600 births per year, which is important and relative to our MEMCARE study because our community engagement focuses on recruiting pregnant women. And so I wanted to provide a context for that, for the community. The median age for the San Luis Valley is 43 years and is about 46.7% Hispanic or Latinx population. It is their largest minority. The median income is approximately $35,000, with about 20 to 25% of the population living in poverty and about 18.5% that currently are on SNAP or food stamps. The predominant economy in the San Luis Valley is agriculture, followed by tourism. And over the past 10 years, they've begun to promote and advertise the San Luis Valley as a retirement destination, especially for hunters and fisher people. Right. So our Superfund study centers around mining. So the history that I wanted to give about the San Luis Valley centers around the populations that settled in the valley, and then the evolution of mining, because abandoned mine sites is the focus of our Superfund. And so the San Luis Valley has a very long history of really rich cultures and settlements, initially with the Folsom and the Clovis nearly 11,000 years ago, and then later predominated by the Ute tribes. The Spaniards arrived in about the 1500s and were the first settlements that occurred in Colorado, and then mostly within the San Luis Valley. The United States acquired the San Luis Valley territory in 1850, and it was in 1870 that gold and silver were discovered, especially in the San Juan Mountains, and then in the northern part of the Sangre de Cristos. This exploded the area to over 10,000 mines, and especially up through the 1900s when gold and silver were heavily mined. Since 1900, this has declined to only over about 1,000 active mining claims as of today. And there's 2 active Superfund sites in the San Luis Valley as a result of these mining locations. Starting in about 1900 is when we saw the shift of the focus of the economy from mining to agriculture. And so next I'd like to talk about our two very specific sites within the San Luis Valley. So the first one is the Summitville mine, and then the second is the Nelson Tunnel Commodore waste rock pile. Both of these are, Summitville mine is a former Superfund site. It's now under the oversight of the state of Colorado, and the Nelson Tunnel Commodore waste rock site is a current Superfund site. Right. So our first slide here is about the Summitville mine. It was a Superfund site from 1994 to about 2018. It was considered the worst and most contaminated site in the state of Colorado, and has involved some of the most complex and intensive cleanup processes. Metals were the highest concern from the mine, especially copper, which had significant amount of drainage, but we also saw other heavy metals, including arsenic, cadmium, and manganese and lead. Most of the contamination that came from the mine was within the Alamosa River shed, and most of the tributaries that then drained into the Alamosa River. And for context, the Alamosa River is located, it drains from outside of the mine through the towns of Capulina and La Jera, and then meets up with the Rio Grande right in the Alamosa National Wildlife Refuge. And so that provides some context. The communities that we will be focusing on are the Capulina and La Jera stretch. Both of these are right along the Alamosa River Basin, and is a predominantly agricultural community. Both of these communities didn't directly prosper from having the mining activity. They lived significantly downstream from the mining activity. So outside of any miners possibly living in Capulina, which was very few and far in between, there really was no direct economic benefit. And most of the economy in this area is agriculture and tourism, where that tourism has more of an ecotourism spin to it, in that they're focusing on people who are going for the migratory event of the sandhill cranes, or they are focusing on fishing and other outdoor activities. So more of this recreational / ecotourism type of interest. The environmental exposures within these two communities are focused on metals, excuse me. And it's very well documented that we saw arsenic, cadmium, lead, manganese, and copper, both in the soil and in the water, where the water was had some direct impact on human consumption. And we also saw some elevated levels in residential yards. However, most of those have been cleaned up and remediated. And what we're looking at right now is, one, the extent, whether we're continuing to see some of this pervasive exposure to metals within the water, and then also looking at what levels are we seeing these at. In a recent pediatric biomonitoring study that I just completed, that recruited 200 children from around the entire San Luis Valley, of those that lived in this area between Capulina and La Jera, we saw water exceedances above the EPA contaminant levels in both arsenic, manganese, tungsten, uranium, and copper. And then we also saw soil levels that were also elevated with copper, chromium, nickel, and zinc. The benefit of this community is they're extremely engaged, they're very well informed, and they're very aware of the metals that are occurring in their environment, not just from the mine. I should really stress, the mine isn't the only source of metals. Metals within the groundwater aquifer system are occurring naturally due to leaching from the bedrock, especially from the San Juan Mountains, which are volcanic in nature. Our second site is of the Nelson Tunnel Commodore waste rock pile, which is located in just a mile north of Creed, which is a small former mining town that is due west of the Capuline and Lahara area. This has been a Superfund site since 2008, where metals, again, are of the highest concern, especially arsenic, manganese, lead, and cadmium. Another area that has been a focus within this is the Willow Creek watershed. And the work that's been done for the Willow Creek watershed has a very long history of citizen science and citizen engagement, which is a really positive thing about this community. I mean, they are very aware of that dynamic between former mining sites and their ecology and their environment, and have actively been working with the forks for both the Willow Creek and then this watershed area. The Willow Creek does drain into the Rio Grande, which you can see at the top of the page here. Separately from the Capuline and Lahara communities, the Creed community has an extremely rich history and culture surrounding mining. So over 100 years ago, Creed was formed, so 150 years ago, and they had a population of nearly 2,000 people, some of them seasonal miners, some of them year-round, all working in the silver mines that were prominent in that area. And then as the mining declined over, up until like the late 1980s, that's when we saw the population decline and the town gets smaller. But the community that's there has an extensive an appropriate amount of pride in their mining history, and that is the basis of their tourism. So their main economy, now is focusing on tourism, especially the attraction of understanding and learning about mining history. And then their other strong interest is in recreation. So most of Mineral County is wilderness lands. So hunting, fishing, use of four wheels and ATVs has become a large interest as far as their economy. And this is the area that we will be focusing our research on. So the entire town of Creed, all the way through the Willow Creek watershed to the Rio Grande. So Creed and the Willow Creek watershed, the main economy was mining until 1980. We're now seeing this shift to more of a recreation and tourism. There's an ecological exposure to metals has been documented through soil and through water. And again, this is a very engaged community that's very protective of their ecology, again, to support that tourism and recreation, but then also to support their foundation, which is mining history. Within this community, there is much less focus on the metals exposure and the direct impact with human health. And they're more so focused on the health of their fisheries and benthic invertebrates and their ecology surrounding their community. Okay. So the objectives of our community engagement core center around bringing together findings and research from the other 3 projects and the total 4 projects within MEMCARE, and applying them to what we're seeing in the community, and having that connection between research and community, that translation piece. And so what we are looking to do is we are identifying what are the concerns for pregnant women and parents of children under the age of 13 in regards to exposures to toxic metals within their community, whether both acute concerns and long-term. And to support the community in leading a citizen science effort to collectively assess how much of exposure is occurring in pregnant women and children, whether it's through water or through soil, and then assessing that exposure through urine and toenails, and following pregnant women over time. And then ideally, we'll be able to provide them with water filters based on what we're seeing within their water and also what we're seeing in their biomarkers to identify the best media for water filters to provide for them to improve their drinking water quality, reduce the amount of arsenic. So arsenic is one of the chief metals that are occurring within the groundwater in the San Luis Valley. And so being able to remove that arsenic, remove the uranium in hopes of being able to mitigate and reduce exposure. And within the paradigm of these objectives, we're looking over a 4 to 5 year period of recruiting up to 60 pregnant women and any child they might have over the age of 3, so potty trained, but less than 13, and begin to look at their exposures and provide this intervention to see if it's successful in reducing exposure. However, right as we are jumping into year 1 and beginning to engage with our community members, funding came in, and then the coronavirus hit. And so the question is, we don't want to stop all of our efforts. And so how do we move forward even in the time of Corona, especially with a community engaged project? So a little bit of framing for COVID in Colorado. We aren't one of the hot spots, but we certainly aren't a low risk. So Colorado has, as of yesterday, 40,142 cases and about 1,600 deaths. 20% of our cases, the highest percent is occurring in those aged 20 to 29, and the highest in race and ethnicity is occurring in Hispanic Latina in 36.5%. Our state rate across the board is about 50.4 per 100,000. Now, what is of concern is that we are seeing significant pockets of outbreaks across the state. And 6 of the 67 reported outbreaks as of now have occurred in the San Luis Valley. They have 467 cases as of yesterday and 15 deaths. 3 of the 6 counties that are within the San Luis Valley have the highest case occurrence, including Saguache, Mineral, and Alamosa, all with levels about 3 to 4 times higher than what we're seeing in this state. And what's of concern here is that the San Luis Valley has very limited medical resources, and in many times people have to drive up to an hour to get to the nearest medical facility. Neither of the 2 medical facilities in the valley have pediatric ventilators, and they do have limited ICU beds. So as an update of our study progress prior to the March 15th stay-at-home order. So in February, once we were notified of the funding and study and project moving forward, we traveled down to the San Luis Valley to meet in person with each of the stakeholders. That key meeting was our big kickoff. We finalized recruitment of all the pregnant women and the children for both of the communities. We finalized our plan for developing quarterly newsletters, a quarterly radio show, a question and answer opportunity and dialogue, and an annual town hall meeting for each of the communities. We additionally finalized our web-based community engagement. So which websites were we going to be posting study information on? How are we going to maintain those, and how many sites were we going to have? On March 1st, we initiated the paperwork between University of Colorado and Harvard for the subcontract, which was executed in June. And at the beginning of March, we advertised to hire our local study recruiter and set up our sample collection and shipments through our local courier. And it's really important, and this part about the advertising to hire a local study recruiter, with all the work that I've been doing in the San Luis Valley, the most crucial thing is making sure that your study recruiter is within the community that you are conducting your research. And the reason why is because they are very familiar with the community, the social and cultural dynamics and sensitivities, and usually they are bilingual. So I predominantly hire bilingual recruiters. Half of the population speaks Spanish, and several of the people that I've worked with in the San Luis Valley have also iterated that there's also a unique aspect about the Spanish they speak. And so it's very important to have that local connection and that ability for the recruiter to connect with the participant that you're trying to recruit. And this will have in a few slides, you'll see why this becomes a little bit of an obstacle or a hang up. So the immediate impacts of COVID is that started in mid-March when we had our stay-at-home order initiated. And as a result, the University of Colorado, we shut down all laboratory and community-based research units up until any reinstitution plans were able to be developed by the university administration. And all in-state travel was restricted. That restriction was eventually lifted on May 15th. And all out-of-state travel was also restricted, and for the most part is still on restriction. You have to undergo a significant approval process. So those were the immediate impacts. And so given that, we reset our focus on first thing we did is we set up Zoom meetings with our current community stakeholders. These are stakeholders that I've been working with for 5 to 10 years and are part of this study as key stakeholders essentially, but they're not new. And so reaching out to them, checking in to make sure, one, how are you? And also find out how the community is doing with this shift. This includes the 2 medical research centers, so Rio Grande Health and SLV Health, which are the 2 main hospital groups within the San Luis Valley. Additionally, the community action groups related to the Superfund site. This includes Headwaters Alliance and the SLV Ecosystem Council. So I immediately reached out to them, set up some meetings. I found myself very fortunate because the chief medical officer for SLV Health was able to schedule a time to meet with me. And you would think in the middle of a pandemic that might happen, but they are very much in support of the research that we're doing and the community engagement we're doing, and he was able to find time. We also submitted our IRB application so that as soon as research activities could be reinitiated, we could get started right away. However, come April, this is when we begin to see the secondary impact of the pandemic, which is not necessarily as bad as the primary or immediate impact, but the long-term downstream impacts that our state budget crisis has created is pretty substantial for community engaged research. So specifically to Colorado, we've had significant job loss, our state revenue loss. March and April are our key tourism seasons because that is when the skiing is the best. It's pseudo warm and the snow is fluffy, and we lost all of that because because Corona came into the Colorado through skiing tourism. The ski resorts were the first thing to actually shut down. So we lost all of the state revenue from that. We've also lost a significant amount of state revenue due to the crash in the oil and gas prices that occurred between April and May. Additionally, on the university system, we also saw a loss of revenue within the university hospital, which has widespread effects across the entire university system. With the loss of all elective and preventive procedures and preventive care, the University Hospital lost on the grounds of about $100 million. We also lost a significant amount of tuition and state funding. And consequently, because of that, there's a hiring freeze at the university. And it's a fairly strict one. They're not budging on that. So now my ability to hire a local recruiter has shifted, and we've had to go back and problem solve that. In regards to the budget in relation to Colorado, you know, the San Luis Valley is one of the poorest communities in Colorado. And you couple that with a budget crisis that centers around job loss and loss of revenues, and the enormous impact on a community like that during a budget crisis is magnified compared to what we saw here happen in Denver. And so the economic situation across the state, and then you couple that with some of the changes we had to account for with the university, was a pretty substantial impact on our research. So between April 15th and June 15th, that's when we started really understanding the extent that this pandemic could have on our study, and began considering how to shift things. So our initial study changes were in regards to the local recruiter. It turns out that we have another research group in our community and behavioral health department that run a research center down there, and we're navigating the process now of hiring part-time one of their students and one of their senior research administrators to be our recruiter, and to engage with pregnant women and collect information and be our boots on the ground study person. We also researched significantly more options for web-based community engagement. And the key thing here is that this is a resource-limited community. So, you know, jumping on Zoom or hosting a webinar, those just aren't going to get to the mass dissemination that it would in maybe a more affluent urban community. And so we have to be a little bit more creative as far as web-based goes, and contactless engagement with the community. We also did receive IRB approval. We also held a second Zoom meeting with our community stakeholders. This included, again, the chief medical officer from both SLV Health and the Rio Grande Health System. We also met with the Public Health Partnership. The Public Health Partnership includes each of the epidemiologists from the 6 counties that make up the San Luis Valley. They are a vital group for engaging researchers to the community and are an important funnel. We also met with the president of the San Luis Valley Farmers Union. I felt like they're a vital partner because of the economic situation, and majority of the people in our communities also work in agriculture. We also met with the Headwaters Alliance and the SLV ecosystem, who are our current partners now. And probably one of the key takeaway messages that we got from our community partners was that COVID had become an absolute crisis in their community. So we were learning about the outbreaks that were occurring. They had, their ICU beds were full. 2 children at that point had been airlifted to the Regional Children's Hospital in Colorado Springs, and test kits were very limited. So the true number of positive cases was actually unknown. When we met with the Public Health Partnership and the president of the Farmers Union, additional concerns were noted. The disparity in COVID infections was very significant. Minorities were especially affected because they were more likely to live in households with multiple families. They were more likely to carpool to work, especially into the potato packing plants. And within the potato packing plants, you know, they work in very tight working conditions. And so we were seeing these mass outbreaks that were occurring within these larger groups of multiple families that were working and living close together. The job loss within the community and resource depletion was also affecting the community. Additionally, the community was becoming quite divided between one phone call and my second Zoom meeting with the Public Health Partnership. With the 6 public health officials that we met with in April, we're down to 3. 2 had been fired by their county commissioners and their county councils, and one left their job due to extreme stress and threats. And again, it just became a very divisive environment for many of the public health officials. And the problem with all this is you add to this that the community, has been suffering from an 18-year drought. And for a predominantly agricultural community, this is a significant stressor that is on the community. And so when we brought our heads together and started, thinking, okay, how are we going to progress our research study given what this community is going through right now? And so our first question back to our study collaborators is, how can our research team that is trained in epidemiology and environment and public health, how can we help the community during this time? And it was when we met with them that we were able to learn their immediate critical needs as collaborators, as community stakeholders, and as members of the community, and how those immediate needs directly and indirectly not only supported our research, but also facilitated our community engagement. And so that was probably the big moment where it's like, this is the opportunity that we need to follow through with for the community, for the long-term success of the research, and also for the health of the community. And so when I worked with the San Luis Valley Ecosystem Council, the first thing they did is they connected me with the Summitville Restoration Stakeholder Group, which is led by the Colorado Attorney General's Office and is looking to disseminate the remaining amount of funds specific for ecologic restoration. And by participating in these meetings and meeting with Emily Splytek, I was able to meet with residents, hear their interests in the Alamosa River Basin, and what are their remaining health concerns, what are their remaining exposure concerns, and overall, where does that fit in their daily, level of concern? So is this, not even on their radar, or is this pretty high? And interestingly enough, with the residents, we found that it is still on the forefront of their interest, understanding, what metals are in their environment and at what level. I also met with a school nurse from the Swatch School District and the San Luis Valley Ecosystem Council regarding their concerns surrounding COVID and its relation to the fact that the San Luis Valley has one of the highest asthma rates in Colorado. It also is one of the highest particulate matter or dust in the air. And you couple that with the fact that it's a wilderness area that is in an 18-year drought. It's essentially a tinderbox, and they've been suffering many more frequent, much larger wildfires. And so the concern with those that are in the medical field and those that actively work with asthma, children who have asthma and other asthma groups, their concern has been, okay, we have this virus, respiratory virus, we have wildfires, and we have this dust issue. What does this mean for our population? How do we help support our community? And so consequently, I'm working with Dr. Lisa Sukuto from National Jewish, and we are putting together and submitting a proposal under the notice for understanding the impact of environmental exposures, where we're also including community stakeholders, especially the school nurses and the school districts, for a school-based intervention for how especially children with asthma can, operate on a daily basis in the presence of COVID with extremely high risk environmental conditions, including wildfire occurrence and dust, and also continue to self-manage their asthma. And then lastly, the Ecosystem Council was awarded a grant to establish an environmental literacy program in school-age children. They asked me to be an expert contributor, and which again affords me that continued opportunity to engage with the community and its members, whether school nurses, parents, and even teenagers. With Headwaters Alliance, this was an interesting and need that they had. So Headwaters Alliance mentioned that back in October there was one of the containment ponds and retainment systems broke, and there was a bit of a flooding event, and this created a lot of concern for the Willow Creek watershed. And they've been collecting water and soil data, and they have aggregated from multiple community groups and agencies a significant amount of water and soil data over a long period of time, both pre and post the Superfund, but then pre and post some of these flooding events. And the question is, you know, are these flooding events, you know, could they happen again? And are we seeing some of the increases in metals exposure or infiltration into the environment as a result of this? And so they asked if our research team could begin aggregating the data, building a database, developing a web-based platform that, you know, is open source to all that might need it, whether it's community members, whether it's community administrators, whether it's researchers, whether it's, you know, pregnant women who want to understand more about their water. And the benefit is that this project itself, understanding the extent of the metals and the water quality, whether, you know, as it pertains to the ecology and plant life, the animal life and human life, is an incredible way to bring all facets of the community together for this singular goal of really just understanding what metals are occurring in the area. And so we did submit an administrative supplement. It's currently in review for the development of this database and web platform. And we've already initiated the work on it. Francesca has been inventorying all the data that we have and beginning to bring it together in a data set. And again, this is a win-win opportunity where it's not directly in line with our objectives, but indirectly is going to support our project in the long term because of how much we're involved in the community. We're understanding more of the history of the community and people's interest, and developing that bi-directional communication, not just on, you know, learning about the community forward, but then also informing the community about health effects and what they should be aware of, like what does a level of 10 parts per billion of arsenic mean? And so that bi-directional communication will absolutely be facilitated by a project like this. And then lastly, when we met with the Public Health Partnership, and again, we were down to just 3 of the counties represented. Their greatest concern, especially as we move through this project, recruiting pregnant women and their children, is that right now their biggest crisis is food and malnutrition. Their projection is that by February, which is the toughest month in the San Luis Valley, that there's going to be a significant number of families that do not have enough food for daily intake, and the food that they are taking in is low on nutritional value. And so, it will be at a community critical level on who has access to food. And so their questions are, how do we connect families to healthy food, especially during the winter months? How do we educate families on the importance of nutrition, water, especially during a pandemic? And, you know, because kids who aren't healthy and nourished are going to also be at higher risk. And how do we broaden the food networks between local farmers, grocers, regional farmers and grocers? And then how do we support the Public Health Partnership and local agencies for supporting their communities? And again, I stress, so this wasn't even on our radar. This wasn't even on the radar of the Public Health Partnership in March and February when we met with them. This became an absolute crisis starting at the end of April, beginning of May. and has only gotten worse. And so the critical need to identify an intervention now and begin working with the community now for this crisis is important. And so we are working with those community stakeholders to support an intervention to address these social determinants of health-based consequences in this vulnerable population. And, the long-term, this in no way, shape, or form is in direct connection with the current research. However, the importance of having a healthy community, especially in regards to food and nutrition, indirectly supports the importance of and findings related to environmental exposures, and more importantly, that interconnected play that metals exposure has with nutrition, whether it's antioxidant intake, and also being able to maintain a healthy body, prevent diabetes, asthma, and other outcomes. All right. So, in relation to the study, so when we met with those community stakeholders and we identified, here are ways that weren't directly in line with what our original intent was with this study, but here's how we can help you that either directly or indirectly helps our study and directly helps the community. What we've also been doing, we've also been maintaining our efforts on our study, and that includes community-based research was only reinstituted at University of Colorado July 15th. Laboratory research was reinstituted back in June, and then community-based July 15th. We had to convert most of the study to being as contactless as possible. That includes the recruitment of the pregnant women, recreating an online consent and survey. We've set up a system where sample collection kits can be mailed to the participants and collected by a courier from the front porch. We've organized that. And we've also increased opportunities and options for our online presence for community engagement. There are two pieces of our research study and our community engagement pieces that are still in person. And the first one is the water filter installation, as that would need to be done by study personnel or a professional. And then our annual town hall meetings. Even though town hall meetings are completely capable of being done by Zoom, everything I've heard from all the community stakeholders has been those need to be in person. Even if it's everyone in a large room, 6 feet apart, wearing masks, that is a necessary must. And that's, part of that rural small town community-based feeling and culture is having everyone have that face-to-face, being able to ask questions, and then being able to continue to ask their question until they understand and feel comfortable with the study and the researchers and moving forward. Not only that, but having worked in this community for the past 13, 14 years, that face-to-face contact just really cannot be replaced. And so the town hall meetings we're going to keep in person through our key stakeholders. All right. Additionally, we are in the process now of submitting our amendments to IRB to be able to complete most of the study online through contactless methods. And also, we're going to be creating a study-wide core document. So in working with Tamara, James Todd, and then Gary Adamwitz, we're putting together these core documents for the community engagement core specific to the Dimick's site and also the San Luis Valley, so that we have these core information that we're collecting across both sites. For the San Luis Valley, we are translating the documents into Spanish, building the online consent and data collection systems. And our goal is to begin recruiting on September 1st. And with that goal, I mean, the goal is September 1st. If we're pushed back a little bit, you know, we'll work with that. Again, that's a moving target because every day, every week, we're seeing different changes in the trends of Corona. We're also seeing changes in the restrictions, both on a local level and on a state level. We have collected a significant amount of historical water and soil metals data from Headwaters Alliance and the SLV ecosystem that go back, you know, in many cases 30 years. And so the amount of information that we're building and aggregating is going to be significant, and also a novel thing for both of these communities, because it hasn't been done before in either community to have a very large aggregated comprehensive data set of all of their environmental data specific to metals, which again are the biggest concern in the San Luis Valley. We're in the process of working to hire a shared worker who's bilingual and local. And we're working with our community stakeholders to identify residents who are on private wells within our communities who would like to have preliminary water samples collected as an analysis with Paul Westerhoff at ASU as part of his project number 4, and then translating that into that connection with the community engagement core. So our goals after September 1st is to continue working closely with our key community stakeholders, including the Ecosystem Council, Headwaters Alliance, and the Public Health Partnership, to continue to advance that community engagement, whether it's indirectly through these other community engaged opportunities that we are doing with them, or whether it's through direct work with this study. We're looking to recruit at least 3 pregnant women and children between now and the end of year 1, which is in February, to build as a very significant online/media presence. This includes social media, community partner websites, community flyers, the local news, the local radio, and the local newspaper. So a lot of the community has Twitter and other social media and have access to websites, but the local newspaper and advertising is still a very dynamic opportunity for communicating with the community. We are looking to host at least 1 in-person town hall with our key stakeholders in each of the communities, and then submitting those COVID response proposals to support the community, and also to complete these ancillary projects. I'm gonna pause right there. I wanted to thank everyone for participating. I'm eager to answer your questions. More importantly, I'm also very open to hearing additional ideas that you might have and suggestions. You know, I certainly haven't tried every option, and I'd love to hear any ideas that you might have.
Thank you so much, Cassie. Really wonderful presentation. And also thank you for continuing to conduct the community engagement research during this challenging time. So we have about 8 minutes left, and I have in the chat box 4 questions right now. And Julie, do you want to read the questions to Cassie, or Cassie, maybe you can go through can you see the chat box?
Sure. We first had one request, if you could share your contactless recruitment methods.
Yeah. So you mean my slides? Sorry. Let's see.
I guess your methods for how you're doing the contactless recruitment.
Oh, the contact, yes. So that's a fantastic question. So we're recruiting. We're very fortunate that we're collaborating with the 2 main regional medical systems within each of the communities. And so we have a nurse/midwife/obstetrician within each of them that is helping us recruit by providing the information about the study. With their assent, then they are providing the contact information to our study recruiter, who will then reach out to each of the pregnant women. Everything will be done by telephone. The consent will be completed online. If they don't have internet access, then we will do it through telephone. And then again, if they don't have internet access, we'll complete the survey. by phone. Those are the two key pieces. Once we have that, then we'll get their mailing address, and then we'll mail to them a kit that will have the water sample bottle, the soil sampling kit, and then 2 of the urine. So if they have a child, then the child can have a urine test cup too. We have instructions for each of the sampling methods. They're on an 8th grade level with pictures and are completely translated. And then obviously we're available for questions if they have any. We will ask them to collect the samples at relatively the same time. And then as soon as they're done, they'll notify the courier who will go pick them up. Courier then takes them through their system and flies them to Denver. They're usually in Denver and in my freezers within 24 hours.
I'm going to unmute Paul Westerhoff. He had a question as well.
Okay.
Hi, Kathy. Paul Westerhoff from Arizona State University. Thanks. It was really interesting to hear about the challenges. You told us a lot about the kind of data sets that might be there. Are there any public water utilities, or are these all private wells in these 2 communities?
Yeah.
What type of might they have?
Yeah, great question. So Creed does have a public water supply, and it supplies most of the township. Outside of the very small township, most people are on wells. Our goal is to recruit people that are on wells because we can have that, direct impact. However, Creed's water system is extremely small, and I mean, you would probably know better about the capabilities of the extent of the water treatments. And so within Capuline and Lahara, both of them, again, very, very small public water supplies. Majority of the people in those communities are on private wells. Rarely do they have water filtration systems that are going to remove metals. Most of them have like a Brita water filter that's attached to their faucet, if they even have anything. So that's where they're at. And then one of the things we do assess very detailed is their drinking water. So how much do they drink? Do they drink bottled water? How much do they drink from their kitchen tap? Do they have a barn and they drink from the barn tap? Because sometimes a lot of the ranchers will have a well in their barn and they drink more of their water from there. And so we'll make sure we assess that water. We'll also get into, finding out what kind of water treatment they have, if they have any. Very, very few people have treatment systems to the level of a reverse osmosis system.
Thank you.
Here's another question. Did you compensate the community-based organizations? Also, how will you hold in-person town halls safely, even with physical distancing and masks?
Great question. So yeah, we are providing incentives to the participants. The kind of gold standard in this community is Walmart or City Market gift cards. They're like gold there, and it'll be $20 per engagement with them, which over the course of a pregnancy and follow-up would be about 4 times. And then as far as the town halls, so there's several key community meeting areas where the common way for these rural communities to exchange ideas and to meet as a community and discuss current events is to come into these town hall areas and have a town hall type format. So it's not unusual for them to host a community meeting in this fashion. There's several government buildings that are large enough and can easily host anywhere between 20 and 35 people. Right now, our state limitation is 25, so no more than 25. So if that remains in place, we'll stay with 25, spread out 6 feet apart. Mask, we're in a mandatory mask restriction area now, so everyone has to wear a mask anyway.
Here's another question. Do you have data about the number of people in the community who have a mobile phone, or did you consider using or creating a mobile app to engage with the community?
Yeah, absolutely. That's actually one of the areas where we are exploring. We have within the center that I work in, we have somebody who's very, very savvy on app development, especially on iPads. And I've been working with him just to kind of explore the options. Most of the people in the community have a smartphone or a phone of that capability. The hard part is that there's many people in the community that essentially live off the grid. So there's no internet, there's no cell phone that belongs to a cell phone provider. So it's more of a, you buy your minutes as you go type phone. So being able to make sure that we're not excluding a group is really important. So making sure we're hitting everything from the newspapers to the radio to flyers at the doctor's office and medical offices, and also the local communities areas is also important.
And I think there's one last question. What did you find when researching options for web-based community engagement in a resource-limited community? And did you consider providing tablets with cellular data or Wi-Fi hotspots?
Yeah, I mean, I would love to do that in a funding unlimited situation. There's the hard part is balancing, you know, when it comes to, you know, that community engagement from, you know, using web-based options. It's the vital component there is balancing that with that in-person component, meaning, you know, that they see a tangible flyer, they hear on the radio, they see in the newspaper. They have to have these more kind of archaic like forms of that we've communicated with, you know, for decades. And so that's the critical balance. And providing the higher level and more novel forms of engagement isn't fully there for the community yet. We're working on ways of being able to use both these novel approaches and also the older ones to make sure we're reaching both sides of the community. I hope that answered the question, sorry.
So I think that's it for questions. Chen, did you have anything else to add?
No, this is really wonderful, Cassie. Thank you so much. And thank you for everyone for being here, and stay safe and well. And we will look forward to see you in the next seminar in a month.
Yeah, thank you so much, everyone, for attending. And if there's any further or follow-up questions, or if you have other ideas, I'd love to hear them.
Great. Thanks a lot.